Recently cut an episiotomy for one of my patients, and I want to talk about why. Hi, I'm Dr. Toya, board certified OBGYN, and I know a lot of people have very strong feelings about episiotomies, but there are situations where they are appropriate, and I want to talk about the one that I was in very recently. This patient was delivering. She was pushing really well. She had some issues with her pregnancy and with this labor, but she was doing well. The heart rate was tracing normally, but then all of a sudden I hear, and I was just like, what is that? Because the heart rate looks normal. It sounds normal most of the time, but there's a slow beat. The patient then, she had on the pulse ox monitor, and I look and it's exactly the same as the fetal monitor. So that usually means that something is not right. We may not be actually tracing the baby, and that's a concern, especially when I hear in the background a very slow beat. In that moment, I had to decide what is the least amount of intervention that I can do to expedite this delivery, because I think something is not right. And in this situation, it was cutting an episiotomy, because all she needed was a little bit more space to get the baby out quicker. She would have eventually push the baby out and it would have stretched naturally and all that, but we did not have the time to let that happen when there's a chance that the baby's heart rate was dropping. And I chose to do that, and the baby came out with the umbilical cord around the neck 3 times and an abruption, which means the placenta started to separate from the wall of the uterus. So that slow knocking that I was hearing was actually baby's heartbeat dropping, and we were picking up mom's heartbeat on the monitor. I say all this to say, if you are thinking about your labor, you're writing your birth plan, and you just have a blanket, no episiotomy on there, I really want you to discuss with your doctor, what situations do they use episiotomies? When do they think it may be necessary? Because it can be a life-saving thing for the baby. Doing them routine obviously is not appropriate, but there are times where it could be helpful. All right, so let me know if you have any questions in the comments below, and like and follow for more.